It's been a long day and a grim subject. So we decided on this panel it would all sit and try to be at eye level with the audience. So as David and John and Garen come up, the idea of this panel was to be cumulative, to absorb some of the comments that have been made today by our presenters, and to think about one or two falsifiable hypotheses that each one of us could leave the audience with. We titled this session with emphasis on firearm control, context to policy with an emphasis on firearm control. And we have David Kennedy, who has been in the trenches in Boston and New York and various other places around the country with ceasefire, looking from the trenches to the community about what can be done. Garen Wintemute is a real pioneer, has been in the trenches of gun control policy and gun control science, I might say, for 25, 30 years. Is that right, Garen?
That's right.
John Rich, who I shamelessly call my student, has been in the trenches in Philadelphia and various other places, using ethnographic approaches to come face to face with violence. So what I think we want to achieve in this session is to bring you as an audience as close to the phenomena as possible. What it means to kill somebody or to be a victim of homicide. What it means to carry a gun, to possess a gun or not. And with those ideas, sort of close off a discussion that has been going on since 9 o'clock this morning. One thought, I'm going to be a moderator, but one thing we have overlooked, I think, maybe not completely, is that violence rate, this came up in Mark's presentation this morning, I think, that violence, homicide, not violence, but homicide peaked around 1993-94 in the United States and was completely out of control, driven to some extent by the cocaine, crack epidemic, but lots of other conditions that were causing the inner cities of America's largest cities to be disorganized. We published a study, Rob Sampson, Steve Rodenbush, and I, in 1997, that showed that despite the peaking of violence, there was a protective factor that was operating in cities like Chicago, we call it collective efficacy. And that if this phenomena called collective efficacy could be understood, what Bob was calling the strength of communities, then it had the possibility of reducing violence rates. As we were articulating this scientific finding, it turned out, beginning 1995, violence rates plummeted in the United States, large American cities in particular. New York and Boston probably were the most dramatic, where we saw the most dramatic declines. But even in Chicago, where adult gangs make reaching violence prevention very difficult, even in Chicago, violence rates were cut by 50%. About 10 years later, 2006, 2007, we saw them creeping up again. And they have now, in Chicago in particular, have caught up to something like 60 to 70% of what they were in the 1990s. So this fluctuation in violence, which has occurred throughout history, is some indication that it's not simply contagion. I mean, you don't cut off a disease without knowing what you're doing, to the extent that violence rates have plummeted in the 1990s. One of the things that didn't happen as a result of the research that we did was that collective efficacy as a protective factor was not instituted in the measurement domains, the demographic measurements of large cities. I mean, we personally recommended to Daley and to other mayors of large cities that they include the simple measure of collective efficacy along with other administrative data so they could monitor what was happening at the community level, because it seemed so critically important. So against that background, I think what we'll do is you'll hear a lot about gun control and ceasefire in trenches from Garen and from David, who will come second and third. David is second and Garen third. But we want to lead off our discussion with what I think of as kind of a bridging presentation from John Rich, who is the interim director of public health at Drexel University and is thought of as one of the most innovative people in the field. John?